We have the money and the means. What we want is action. Aggressive campaigning here has halved the number of people expected to get HIV/AIDS.
Dress your willies. Do you know what condoms are for? Are you having sex? Well, are you?
Without treatment, most of sub-Saharan Africa's 25 million HIV-positive people could die in the next 10 years. That could create a food crisis and leave 20 million AIDS orphans. The Millennium Development Goals. Make our leaders keep their promises. 8 goals, 1 world.
Pope Benedict XVI set off another political firestorm even before he landed in Africa, saying condoms could make the HIV/AIDS crisis worse. He told reporters it's a tragedy that you can't resolve it with the distribution of condoms. On the contrary, it increases the problem. Health experts disagree.
Because condoms have been proven time and again to play a major role in the prevention of the transmission of HIV infection.
The Vatican is pushing sexual abstinence and one-partner relationships to fight HIV/AIDS.
In certain circumstances, abstinence is important, and obviously if you don't have sexual relations, you're not going to get HIV through a sexual contact, but it has its place.
But some priests and nuns working with AIDS victims in Africa question the Church's anti-condom policy. President Bush poured billions of dollars into HIV/AIDS programs in Africa for treatment, education and prevention. But like the Pope's message, those programs stressed abstinence and monogamy while downplaying the role of condoms. Experts say people need to listen to community leaders and healthcare workers on how to avoid HIV infection. They say, with due respect to the Pope, that this is a health issue and not a religious issue. The Church would argue this is a morality issue.
Through its hospices and hospitals, orphanages and churches, its parish outreach and international agencies, the Catholic Church has been a crucial player in virtually all aspects of the global response to HIV and AIDS. Its presence in cities as well as rural, remote areas around the world puts it at the center of the pandemic.
Almost immediately, people with AIDS, especially in high prevalence countries in Africa, came first to the church healthcare services. Many of the government-sponsored and other healthcare services in these countries were afraid of people with AIDS. They rejected them. They wouldn't treat them. The church opened its doors to provide healthcare and then provided special social services and support both to the people directly living with the virus and to their loved ones and to their survivors.
The joint United Nations program on HIV and AIDS reported that in 2007, over 7,000 people were newly infected with HIV each day, with young people aged 15 to 24 accounting for 45% of all new HIV infections. In just a little under 3 decades, the virus has infected 65 million people across the globe and killed more than 25 million. The Catholic Church approaches the challenge holistically, understanding that medical care addresses only one aspect of HIV's effects, so it puts to work its vast array of services, administering antiretroviral therapy, helping families care for their sick at home, providing prevention education, reducing stigma and discrimination, supporting orphans and other vulnerable children, administering the medical care to alleviate the symptoms of the disease, providing food, ensuring children and adults get a decent education, and helping affected families support themselves through employment and small businesses.